welcome everyone to this webinar about communication about late effects. It's great to see that so many of you registered and so many of you are already here and have been waiting for a couple of minutes. And I think over the course of the next couple of minutes, probably a lot more people will join, but we'll just slowly but surely get started. So some general remarks before we start. This webinar is recorded, so you will be able to also view the recording on YouTube or on the PenCare website after the webinar, or share it in case you want to share it with anyone. During this webinar, you cannot turn on your video or unmute yourself because we are recording it, but that doesn't mean that we don't want to hear your thoughts and opinions and questions. So please, during the webinar, just think along in the chat and ask questions in the chat, and we will, of course, try to get to them. And last but not least, next to me and my co-host, Helene, there is Jaap and Jeroen here today, who will be with you in the chat in case you have any quick questions that we cannot get to, but they can try to help you with. So I would like to take a moment to introduce myself and also my co-host, Helene. My name is Tessa. I'm a project manager at PenCare. I've been working there for a couple of years, involved in different EU-funded projects around survivorship care, and I'm excited to be working on YARN and specifically bringing this webinar series to you today. Helene, maybe you could also shortly introduce yourself.
Hello, my name is Helene, or Helena, whatever you prefer. I will listen to both. I'm a medical oncologist and I work in the Princess Maxima Center at the Late Effects Clinic. I also do research into late effects, and I am one of the former chairs of PenCare, and I'm very interested in how we can better communicate with people with lived experience. So I'm looking forward to this webinar.
Thank you very much. I'm very happy to have you by my side today. I would like to start with a couple of general things about the YARN project, about the series, so you all maybe understand the context of why we're here today. The YARN project, or the European Youth Cancer Network project, is a project that mainly focuses on empowering young people affected by cancer. So the main aim is to really build a network of adolescents and adults impacted by cancer, and implement psychosocial and mental health care standards, offer education and career support, and to develop resources for long-term follow-up care and transition of care. And one of these resources is this webinar, or the webinar series. And this webinar series, it's called the Quality of Life webinars, mainly aims to educate and raise awareness of the quality of life of those affected by cancer, specifically young people. So we'll try to cover topics like late effects, mental health, psychosocial care, transition, and long-term follow-up care. And the series spans over 3 years, and we will deliver at least 9 webinars to you, maybe more if we can, and if you're interested. And also at the very end of this webinar, there will be a survey or a form to give feedback to this webinar, but also within that form, there's an opportunity to let us know if there's any specific topics you would like us to cover in the future. So please stick around for that and let us know if you have any topic suggestions within the scope of what I've just shared. And this webinar today is mainly organized by PenCare. So I would also like to take a very quick moment to tell you a little bit about PenCare. So we're a multidisciplinary European network. So we bring together professionals, people with lived experience, and their families. And our main mission is to ensure equal access to optimal survivorship care and to improve the life of those affected by cancer, which is a big mission and not something done within a day, but I'm very happy that we have this project and these webinars to, well, take a step along this way. Now I've shared a lot about us and what we do and why we're here today, but I would also really like to get to know you, as in our audience. So please take out your phone or click on the link that Jaap just shared in the chat or go to menti.com. And we would just like to ask you a couple of questions so we know who you are. I think that will also be really helpful for our panel discussion later to know who we are talking to. So I will leave on the QR code for a couple more seconds and then we will go to the Menti. Okay, I hope everyone has the QR code. Otherwise, 5 more seconds now, because I will stop sharing. And I will... Oh, you're already answering. You are super quick. Wait, let me share the results so everyone can see them. So the first question was, well, you have apparently all already read it and answered it, as who you are participating today. So I see that we have a lot of healthcare professionals and a lot of people with lived experience here, but also patient advocates and some research. So it's really a very diverse audience we have today. And I'm sorry to those who are just other. I wish I could make categories for everyone, but then we would just have a lot of ones. But I know you're here and I see you. Yeah, but this is really, really, really great to see such a diverse audience today. And we will get to the next question, which is, which country do you live in? Again, because it is really helpful for us to know where you're from, which healthcare system you are in, because we can then take it into account a bit during the panel discussion. And again, I'm seeing a lot of different countries.
And some people are also entering in the chat. So that's Portugal and Australia, Hungary.
Well, I am not quite sure how we managed to reach all of you, but I'm very happy that you're here. And now I wish I would have added to the feedback form, how did you hear about this webinar? Because I'm really curious, but well, regardless, it's great to see all of you here. And I think we can move on to the next question, although I see some people are still adding. Okay, I think now we can go to the next one, which is, what do you hope to learn today? Because apparently you found the topic interesting enough, wanted to hear a webinar about it. So I'd be really intrigued to get to know a bit more about what made you sign up. What do you hope to learn? What do you hope to get out of this webinar today? And of course, we can then also try to take it into account during the webinar. So I see best care ideas, different approaches, new approach, best care ideas, more about pen care. Well, it's all a bit linked to pen care. Develop materials. Okay, that's interesting. How to best advocate. Oh, understanding young people. I'm starting to hit an age where I also face that sometimes. Anything to help survivors. Yes, that is a really great aim. Awareness of late effects. Balance between knowledge and I assume something else that didn't show anymore. Did I miss something, Helene? I'm starting to
Well,
get...
that's just in the chat is
Oh,
care after treatment and anything to help survivors. So I think that's the awareness of late effects, and I think it's all there, right? Really interesting.
yes. Oh, also I see support survivors' families. I think that is also really interesting because communication can be very different depending on who you talk to. Sensitivity, I think, is also a really good word, to be mindful of what you're saying and what your words can do or how they can impact. Yeah, I hope I didn't miss anyone. But
I think we have a very good overview of what people expect. So the expectation is high. I'm really hoping, but I have all faith in our panel and Hanne.
Yes, yes, me too. And the last question before we get towards to get our audience to work a bit, what do you think are characteristics of good communication about late effects? We already heard, I think, some of them a bit in the previous one, but just at the top of your head, what do you think is a good way to talk about late effects, or what should you really take into account when you talk about late effects? Oh, empathy is very big. That is good. Honesty, yeah. Uh, I think sometimes also a bit underrated. Compassion, clarity, listening, also I think a very, very good one, to not just, it's not a one-way street, right? Really no pressure. Yeah, just I think not, just talking and taking a list and reading it, but having a conversation. Tailored to the patient, listening time, flexibility, I think also a very interesting one. Um, Age appropriate, also very good.
And we in the chat we have knowledge is power, and share experiences.
Well, I mean, you all seem on the right track, I think, already. So I hope we can add something to your knowledge, which I think this is a great word cloud as it is already. So I think if you haven't done so yet, please finish your word and add it. But this is, wow, I'm a bit impressed. So I think this is really nice already. And I hope we can add something to your knowledge that you apparently already have. So I will go back to my presentation and stop the Menti for now. So, I think we've already shared a bit that we'll have a panel discussion today, but I wanted to take a moment to let you know what you can expect from today. So first, we'll have a spotlight presentation from Hanne. I will introduce her in a moment, about effective communication and specifically available resources that you can use to learn more about communication or to improve communication. And then, as I said, the heart of the webinar is really this panel discussion. We have a wonderful panel of experts, people with lived experience, professionals, and a researcher. So I think we can really take a look at it from every angle. And in the end, we'll, of course, wrap it up. And as I said earlier, there will be the chance to give feedback and so on. So without further ado, I would like to introduce to you Hanne Lie. She is a patient expert and psychologist. She works for Childhood Cancer International Europe. She's also a survivor herself, so she really brings all the experience for this topic. So I'm super happy that she prepared a presentation for us. And if you have any questions or thoughts, you can put them in the chat. And we have a couple of minutes after the presentation to answer your questions. Yeah, so please do so and think along. And Hanne, go ahead.
Thank you, Tessa, so much for the nice introduction. And hi, everybody. I'm happy to be here with you today. And yeah, as Tessa already said, I prepared a short presentation for you, focusing especially on the resources that are, or some resources, not there. I'm pretty sure there are much more out there, but some resources that, yeah, we can offer. And yeah, I would say let's start directly into the topic. Wait, there we go. Okay, so I was thinking, even though I guess all of us are actually coming out of the survivorship scene, I would say, I still wanted to kind of set the scene a bit for all of us so that all of us start from the same starting point. So let's quickly talk about survivorship in Europe. How does this at the moment look like? What are kind of the numbers that we have at the moment? So we think, or we know that currently approximately 500,000 young cancer survivors are living in Europe. The numbers are still getting more and more, but this is the approximate number that we are having at the moment. And we also... Sorry? Okay. And we also know that about 75% of these survivors experience late effects on the physical, but also on the psychosocial level. The thing that adds on this, that we still are lacking of awareness across Europe of the fact of late effects that can occur, and that we also lack of follow-up structures at the moment. So this is our starting point kind of for today. Yes, so you might know that YARN is kind of the follow-up project of another project that we had in the last recent 3 years, which was also an EU-founded project, which was the EOCAIAS-NET. And within this project, which was the first one actually that was really led by patient organizations, and where all the things that we did within this project was co-created by, on the one hand, patient advocates, patient experts, and healthcare professionals. We also had an online survey about care gaps that we're having within survivorship in Europe at the moment. This survey was co-designed by, on the one hand, clinical psychologists, patient advocates, but also together with a pretty big consensus group. And for us, it was really important to have evidence, but also consensus within this survey. And this should also include additional topics really based on the needs of the patients out there. Yeah, so you can see a few numbers. This is not like super important, but I thought still it would be nice to have it in there. But we had about 195 participants from altogether 24 countries. And we also had a pretty good variability of different tumor and cancer types included into this. So why am I telling this now? Because we had some pretty frightening outcomes actually, and one that I picked out for our topic today was what is actually the biggest needs that we could see out of this survey. So we could see that there is actually a pretty high psychosocial burden due to physical late effects after a cancer treatment. I don't know if you can see the numbers, they're pretty small, I know. But we can see, for example, the neuropsychological issues are pretty high. We can see that fatigue is pretty high. We can see body image issues are pretty high. So we can see that there are a lot of needs concerning this. And we could also see especially that the needs that are out there are much bigger than the communication that actually happens about psychosocial late effects and the support that is received. And that really all groups are affected by this. What could be now, and this is not like proved by this survey, but what could be now a possible consequence of this lacking communication that we have out there can be anxiety problems, anxiety disorders, and other anxiety issues due to lacking conversation about late effects that we have. We know out of a study from 2022 that an anxiety disorder is up to 20% higher than in siblings and other comparable populations. And within our studies, we could also see that 57% of the people that answered to the survey reported that they actually would have need support for increased anxiety and anxiety disorders. And out of these 57% that reported this need, only 5.7% these issues really have been addressed. And again, 8.2% of those that reported this issue also actually received support. So we can see that there is still a big lack and issue in communication about these things and in communication about the late effects that we still need to increase. But that's what we are here for today. And I'm very happy that I can now present to you some resources that hopefully will help communication and increase it so that in some time all the survivors are going to be super well informed about the issues related to late effects. So first thing that we did, or one thing that we did also within our EOKAIAS NET project, was to create a guide on talking with survivors about their possible late effects. What we are really proud of is that this guide was really developed by survivors of childhood cancer, adolescent and young adults cancer. So this means that this guide is really based on experiences, challenges, and insights that are shared. So we did this within a workshop, which was 1.5 hours. And the recommendations really reflect what the survivors have found helpful or lacking in their own care. So the goal of this guide is really to support better and more transparent the communication about late effects and also follow-up care, of course. So this is the guide for the methodology. This was really based on open discussions in an EOKAIAS NET workshop with people that are living with or beyond cancer. In an open round, we asked them questions to different topics, and they really shared their experiences, their challenges, and also their unmet needs. And we focused the discussion within these 1.5 hours really on the communication about late effects and the follow-up care. We tried to have it really broad and explored the when, the how, and also the whom. So when, how, and by whom late effects are discussed, should be discussed, and we want to have it discussed with. We examined what was helpful, what was lacking, and what was difficult also to ask for us on the survivor side. And also considered, for example, issues like the readiness and timing for receiving the survivorship information. And based on these insights and these very lively discussions within these, actually it has been a bit more than 1.5 hours because it was very intense. And these insights were then used to formulate the practical recommendations for communication. So we found out that there are basically 4 main topics that we then focused our recommendations on. So the first one was the survivor-centered care. So actually it was kind of the outcome of this special topic that it's always the survivor that needs to be in the center to understand, okay, are they ready? Are they at this point already? What do they need at this moment? Do they need more? Do they need less? So this was kind of the first topic that we agreed on. The second was then on communication and information sharing, so to give a bit more input and guidance also on that. Then we also had the very important topic of emotional and psychosocial support within these kind of informations, and of course last but not least, also the respect and empowerment within these kind of conversations. This guide, as also all the other resources that I will be sharing today, are available at our beatcancer.eu website. I also have a slide in the end where you can access all of them through an QR code. And I think also that they will be shared in the chat. Yeah, exactly. So all of them are freely available for everybody of you. So the next resource are the EOCHIAS.net pocket cards. Again, this is a tool that was, again, co-designed as all of the resources by patient advocates and healthcare professionals to really enhance the mental health and psychosocial care for people living with and beyond cancer. The goal was to have here a really user-friendly resource that contains practical tips, that has expert guidance there, and really valuable information for patients, family, healthcare professionals, advocates, and everybody that is basically interested in these kind of conversations. And the idea is that they will serve everybody of you as a foundation for a dialogue among people with and beyond, living with and beyond cancer, their families, other healthcare professionals, and everybody basically who is involved in the process around this. Yeah, the good thing about these pocket cards is that they are meanwhile available in 13 different European languages. You can see the list here. And are also, again, available on the beatcancer.eu website. And here you can also see the topics. We have some of them. There will be also coming others in addition to those that we already have. But for today, I was taking out those that might be the most interesting ones, especially for the communication, or when we talk about communication and what concerns follow-up care, and talking about late effects. And for today, I will only focus on the first most obvious ones, as they are really concentrating on long-term follow-up conversation about late effects. So the first one is the pocket cards about the topic of talking with young people about serious matters. This is really for not only focusing on late effects, but basically on all, as the title says, serious matters that might come up in contact with young people. And it is actually also a bit kind of a very, very short summary also of the things that we had within the guide that we have created, and is kind of not a step-by-step guide, but things that really need to be considered in talks like that. And the second one is an addition to the first one, which is the do's and don'ts in communication, things that can or should be actually considered before engaging in a conversation with people, especially living with and beyond cancer. So questions that can be asked to self-reflect a bit, your personal position, your personal feelings before you go into that conversation. It also contains some key takeaways for you before you are involved in such a conversation, and really having some short input on what to say and what maybe not to say in such a conversation. And then last but not least, we also have the PanCare Plane summaries. These are, again, a co-created resource that are simple, easy to understand brochures on possible long-term effects of cancer. They have been created now during several projects already, starting with the PanCare follow-up projects, which started in the year of 2019, going up through other projects, and now we're here within Yarn able to still go on with creating these really, really great summaries. And the basic idea is that these summaries are translating IGHT, so International Guideline Harmonization Group guidelines and expert consensus-based recommendations that are in pretty medical terms and medical language, and they translate these medical terms and medical language into really a clear and easy to understand language for everybody out there. And they should really support informed decisions. They promote self-management and facilitate the communication for everybody, as they really make you aware and inform everybody about possible late effects due to cancer treatment. And yeah, as already said, within the PLANE group, there are also patient advocates involved on a very high level. So this is also in co-development. Maybe to explain also a bit the term of PLANE. So the idea of these is really to have them person-centered, to have them in lay language, to have them accessible, international, and navigable. And at the moment, which is a great success, I think they are not only available in English, but also in Dutch, Greek, Hungarian, Italian, Spanish, and also in German very soon. So this is a great success and happened by the support and work and effort by many people that did this voluntary and outside of projects. So this is a huge success, and we're happy to have this also in several European languages meanwhile. For the design of each of these summaries, all of them are kind of having the same build up. So there is the mention of the late effect. Each of the summary is focusing on, also explaining a bit the, let's call it body part that this late effect can occur. It's also having a closer look on who is at the higher risk of that particular late effect, showing also if this depends on a certain drug, if this depends on a certain radiotherapy and things like that. Also focusing on which symptoms and signs you may need to look out for. Also, in case you are at higher risk for this, which test should you have and when? Then also asking, of course, the question, what happens if you develop a particular late effect, and what else you can do, referring to lifestyle decisions and so on. So this is how each of the PLANE summaries is built up and designed, and each of these questions are answered in each of the PLANE summaries. Yes, so to finalize this short spotlight presentation, I prepared also some take-home messages, and also these take-home messages have been based on several conversations I've already led concerning communications about late effects, and I hope that they will stick in your minds and help you also to get maybe a bit of a different focus on these kind of conversations. So because this is a question that was quite often asked also to me on, yeah, but isn't this frightening to hear about late effects? And I can say, yes, of course, it is frightening to hear about possible long-term effects that may occur. But I can also tell you that the uncertainty and the unexpected things that are coming up are even more frightening. So it's always better to have this kind of frightening moment in a guided place where I know now that there is somebody in front of me that I can ask questions before I experience all of these things my body might do without anybody that I can ask. So what's also important to have in mind there is that uncertainty after the treatment makes it already harder to trust our bodies again. And therefore really honest, realistic information matters. So don't sugarcoat, help to set clear expectations and make us aware that there might things be coming up. Because knowledge and support empowers us to take care of our health with confidence and awareness. Thank you so much. as promised, here you can find the QR codes, and I'm happy to take questions in case anything came to your mind already.
Yes, thank you so much, Hanne. And maybe you can just leave the slide on for a couple more seconds in case people would like to scan any of the QR codes. So I think for all those who were looking for new approaches, there's some reading material after the webinar. So hopefully, and of course, also you've summed up very nicely different aspects of good communication. So are there any questions for Hanne? So far, I don't see any yet. One question I would have is, especially for the guide, the one on the left, from experience to action, how would you envision that it could be implemented if I was now a healthcare professional and I would want to improve communication in general in my clinic? What could I do with the guide? How would you envision that?
Well, I mean, there is a lot of information in there, but I think it would be already a good start if everybody that needs to engage with survivors and talks about late effect and talks about long-term follow-up care would go through it and see, okay, what of those things am I maybe initially already doing? What things am I a bit missing out? So I think it's also a bit of a help for self-reflection, how you already engage in your communications. And I think this would be already a good start to go through it and see, okay, what am I already doing? What is maybe a bit missing out? And then I think it would be a good start to, I don't know, pick 3 of the things that you do not do yet and start implementing them. And see how it works for you, if it feels more or less naturally. And you can also always get feedback from the survivors. I think this is a thing that you can do together, especially when this is more or less new to you. I think this can be kind of a giving and receiving thing to learn every day something new. And so, yeah, to start with 3 of the things that we mentioned that you do not yet already, I think this could be a good start for everybody to implement.
Thank you very much. And as a final question, I see Patricia asked if you have any additional plans to disseminate this information. She says wonderful information through Europe and nationally. So is there any additional efforts to get this information out there?
Well, actually, I'm taking every chance to disseminate and mentioning it. There are no clear plans, but yeah, every chance that comes up, I'm taking and putting out the guide there. So recently, for example, we had another project, a meeting, and I mentioned also there the guide and sent out the link to it. So yeah, there are definitely plans to disseminate it, but not like a scheduled plan already, more or less. I'm going with the flow.
Yes, and now there's 77 more people in the room who know about it and who can also spread the word. I think for these kinds of things, it's so important just to keep on talking about them, reflect with yourself, reflect with colleagues or other survivors on how you can and want to change the way we talk about late effects. So Hanne, thank you very, very much for this wonderful presentation, for these really good resources that are there and that are ready to be used. And now, as the next part of this webinar, we will have a panel discussion. So while I'm waiting for Jeroen to spotlight everyone, maybe I can just shortly tell you a little bit about what to expect. So we have a very multi-stakeholder panel, I would say, and we will go a bit more into detail about what communication actually can look like. And also, this is your opportunity for the audience to ask questions and think along. Of course, we have prepared topics, but this is really also an open invitation to think along. Let us know what you think, if you agree or disagree, if you have any additional thoughts or points. you would like to add. Yeah, so definitely interact with us in the chat. And I see that everyone is here now. So before we start, I would like to ask everyone to just shortly introduce yourself and maybe tell us a little bit about your role and how your day-to-day relates to late effects. And well, Hanne, we kind of already know you, so I hope it's okay that we're skipping you. And next up on my screen is actually Emma. So go ahead.
Hi, I'm a long-term follow-up clinical nurse specialist and working in the UK, and I'm also a PanCare board member. So I've been working in long-term follow-up for about 15 years.
Wow, so I didn't know that number yet. It's a lot of experience to draw from. Hanne, you're next.
Hi, I'm Hanne Lie from the University of Oslo, an associate professor in behavior medicine. I've been doing research in survivorship care and have a very special interest in the communication about late effects. And I'm also in PanCare and Equal, which is about the psychosocial challenges of survivorship. So yeah, happy to be here.
And we're very happy to have you because I think it's so, sometimes depending on the context, it can be so important to back up your opinion or what you want with actual research. So I think it's really valuable that you're here today. Natasha, you are next on my screen. You are still muted, Natasha. Oh, there you go. Now you're...
Okay, great. Thank you. Yes, so my name is Natasha, and I had Hodgkin's lymphoma in the 1980s. So I'm a long-term survivor, and I've been invited today to talk about that. I was treated in the UK, and I currently live in France.
Thank you very much. Also very, very happy to have you here today to your experiences. And Maria, you're the last one.
Yes, so I'm Maria Otth. I'm a pediatric oncologist from Switzerland, and I'm running the long-term follow-up clinic in St. Gallen and Zurich, where I see children, adolescents, but also adult survivors. And I'm also a board member of PanCare. Yeah, happy to be here.
Thank you very much, Maria. And also, yeah, there's so much expertise on this panel, so I'm really happy that all of you are here. And maybe we can just start with Natasha and Hanne, because I'm really curious when was the first time that you ever heard about late effects, and what was the context of when you were informed about it at first? And yeah, maybe you could just shortly share how that was. I'm not sure who wants to start, but please just go ahead.
Go for it, Hanne.
Oh, okay. Well, thank you. Yeah, so that's a bit of a difficult question for me, because I know I have been informed about late effects kind of by my treating doctor, but they were more or less only mentioning, the kind of short-term follow-up care within the most recent years, after 5 years after the end of treatment. So this I remember very clearly, that they mentioned, hey, there will be some follow-up and some additional things that you will need to have a look at, but that this will be a lifelong thing. I at least cannot remember that this was mentioned in my presence. And so within Austria, our national cancer organization, they organized symposia for us. And I was at one of them, because I was also included into our national work at some point. And I was at the very, very first one of them. And I was hearing a presentation that was focusing especially on cardiac issues that might occur after treatment. And I know that they mentioned a special medication. I cannot remember which one it was. And then I was like, hey, that's actually a drug that I received. This might be affecting me too. And from that point on, I was listening more and more, and then it really came to my mind, understanding, okay, this is not only a thing that is affecting me for only 5 years after end of treatment, but this is actually of high importance for me for the rest of my life. And this was actually the point where I realized that this, is a lifelong thing that I need to have in mind, that I need to take care of. So this was my story for long-term effects.
So did I understand correctly that it was actually a symposium specifically for survivors, like a peer event, or was it a medical symposium?
It was organized by our national organization. The presentations were done by professionals, but the target group have been survivors, patients, and also caretakers.
Okay, thanks for clarifying. And Natasha, how was that for you?
I wasn't told about late effects. So like I said, I was treated in the 1980s. The only thing I was told was the potential of infertility. And the rest I found out via the internet when I started having problems. So the first thing I discovered after I was hospitalized in emergency for a stroke, I then started thinking that I'd already had breast cancer, so I'd already had a mastectomy, which I found out was about radiation treatment that I had. And then afterwards, as the things started accumulating, I had cardiac issues, etc., bone issues, neurological issues. It just started accumulating. In the beginning, I just pushed through and thought, oh, well, just get on with it. And then actually, after being taken to hospital, and it was pretty dramatic, I actually went on the internet and I found the Children's Oncology group, first of all. After hunting for a few days, I found them. And then I found Hodgkin's International. I tried different charities and I was struggling to find out the information on the internet. But eventually I found it. So that's then I did meet an oncologist once in the beginning, probably about 20 years after treatment, because I started having very strange neurological problems, extreme tiredness, which I couldn't understand because I'd been a triathlete, was very sporty. The breast cancer for me was simply, it wasn't a major deal. For me, I didn't have chemotherapy or anything. I just had a double mastectomy, not just, but I had a double mastectomy. But yeah, so I think it was a bit of a strange patchwork, a very uncharted roadmap for me that I had to basically find out everything for myself.
Wow, I mean, I think we can all agree that both of these scenarios is not how it should be. And I'm really sorry that it was like that for both of you. And maybe Emma and Maria, maybe you could share how this is now done in your clinics in the UK and in Switzerland, or what the general procedure is like and what you think it should be like, most importantly.
Yeah.
Emma, go ahead.
So I'll start just because we have been gradually sort of refining the way we talk to young people and their families about long-term follow-up. Initially, and now sort of routinely, we'll certainly talk to parents first if the young person is under the age of 14, and then talk to the family about how to start talking to the young person about it. But we generally like to start talking to the young person and their family right from the minute they enter our long-term follow-up clinic. So that's 5 years from the end of treatment. Some would still say this is too late because it comes as a shock. You think 5 years and you're done, and then it comes with that information. But our long-term follow-up clinics start at 5 years, and it's not always easy, and it's really important to get the young person and family on board and to find out what they want to know when they want to know it, and to also make sure that the information that you're sharing is age appropriate, and know that you've got plenty of time to talk about that, because you will see them we see them every 1 to 2 years. So it's not about saying everything right at the very first appointment, but just to know that you do have that information you are willing to share as appropriate.
So maybe I can just add, I mean, it's quite similar in our situation, but what's a little bit different is that we don't have always this really clear cutoff with these 5 years. So personally, I see some of them already 2 or 3 years after the end of treatment. And then quite often also at this stage, I sometimes start talking about this because, for example, if they get an echo, they don't get it because of the cancer they had, but because there could be potential late effects. So that's also how I, also my colleagues, we start maybe also at early stages gradually talking about it. But as also Emma said, I mean, it really has to be age adapted. So with children, quite often we rather talk with the parents, but when they get adolescents, slightly, start informing them as good as you can and as prepared as they are. So I mean, they are always at different stages, and we adapt it quite to the age and how they are, how much we talk at which point, and how fast.
Yeah, thank you both for sharing. I think there was already a lot in this that we're going to get into more details later. But Hanne, we previously discussed that you actually had done research on the preferences of what, when, and how. So maybe you could just share some highlights from that, because you've spoken or surveyed a lot of survivors, right?
Yeah, so it started out actually the whole research project with the clinicians at the pediatric follow-up saying, oh, we give so much information about late effects to our survivors, but our patients and their families say they get no information about late effects, so we don't know what's happening. So we wanted to sort of do research on this, and one part of that was doing a national survey in Norway of all the childhood cancer survivors and young adult cancer survivors diagnosed from the 1980s through to the 2000s. So we asked what they wanted information about, how and when, and by whom. And there's no questionnaires designed for this. And we did some focus groups with people who had lymphoma a long time ago and had lived for a long time without information about late effects. That were then invited back in for a clinical examination where they did get a lot of information about late effects and found a lot of late effects. And then we invited them 2 years later for interviews about, how do you want information about late effects? So they say, like was mentioned, it should be a process, start early. Most people preferred throughout the follow-up care. I know healthcare professionals are obliged to provide some information at the beginning of treatment, so you can make informed choices, but they said we don't remember any of that, especially if you were young at treatment. So it should be a process. And if you were young at treatment, they would really like to be reinformed around 25, so in the mid-20s, when they're starting to think ahead and for the future, not just live here and now as a young adult. And they would like to have it stepwise. So like they said, it could be really quite frightening and anxiety-provoking information, but it was much better to have the information rather than not have it and then be surprised by late effects turning up. So it's a real issue of not trusting your body, right? Because it has let you down majorly once before because of the cancer. So they suggested to sort of say, that medication you had, the orange one, that can cause effects on your heart. Would you like to know more about it? And then give a little bit more information and check in. Would you like to know a little bit more? And just sort of check stepwise, so you don't just come with the full list straight away. And we found that in the survey as well. That's how people preferred to have it. And then honest don't decorate the terms, just be honest and open but respectful about it, but keep an eye on how the person is reacting to the information. And the list of what they wanted information about is long. There's a lot about what late effects are, how do you detect them, how do you manage them, what you could do yourself about them, and what are red flags that should cause concern and help you trigger you to seek help for them. sort of the main take home, I think, messages from the survey and the focus groups.
Thank you so much for sharing, Hanne. And I saw a lot of nodding heads on the panel. So I think we all, it seems at least, agreed that you shared really valuable and also practical tips for the people in the audience. Emma and Maria, I would be really curious to hear, as healthcare professionals, what you maybe yourself experienced as challenges when it comes to talking about late effects and how you deal with those, or also maybe sometimes you talk to colleagues of things you find tricky, maybe certain topics. So if you could share a little bit about that, I would be really curious to hear.
My first thought when I heard Hanne speak was just exactly that, when she said about needing to go over it again at 25. And my goodness, we do start, sometimes as young as 8, we'll be talking about things. And there are some young people that want to know nothing of it. And that coming at sort of 22, 23, also, it does happen to be more the males, for whatever reason, who will then come down and sit down and say, hey, Emma, that treatment, can we go back over it? And they're finally ready to look at and tackle that side of it. And I really think that's why it's so important that we enable young people to have access back into long-term follow-up. So even if, and we do inevitably have to discharge young people from follow-up, but everyone should have that ability to phone or email their treating hospital to say, I need the information now, would be my thoughts.
Yeah, maybe I can add just also kind of personal experience. I think what barriers personally can be is also what Emma already said. If some of the survivors, you realize in the clinic they really don't want to know it now, and if you see them after 1 year, that still you start tackling it again or just slightly touch on the topic again, and just that sometimes as a kind of a barrier that you just start talking about it again, even though maybe he's not or she is not really open to it, but that you continue. And I think the other, but that's luckily really rarely than when you have adolescents and they don't really know what they had. So starting in there, that's sometimes difficult. And I think, but that's more maybe also organizational. Sometimes it's just lack of time. So because these consultations, they need time if you want to do them kind of properly. I think that's one thing. And also what you mentioned, Tess, is about colleagues. I think many of them would be interested also in knowing more or maybe doing it kind of better. But also here, I think time is an issue and also knowledge. So if you don't know as a physician yourself how to talk or what to talk about and how to answer if questions come, if the question comes, and now what am I going to do if I know that I have this problem, then you also need to have kind of an answer. And I think that's maybe a barriers on the colleague side sometimes.
Can I just jump in?
Sorry, go ahead, Natasha.
Yeah, I was just going to say that, I think that's, as I say, going back to the 1980s and then follow up from there. The problem that our generation came across was the lack of knowledge. So the information was there, the research was trickling through to the professionals, but it wasn't getting down to us. It wasn't being filtered through. So, I'm thrilled to have got in contact with Equal, PanCare now, and to realize that actually things are changing. And there is an agency being given as well to survivors to be able to actually look after their health, to anticipate potential things that could happen and to put the steps in place. It's just lovely. I mean, when I met the Dr. Demour from Equal, I had already put in place everything. I had already done it. I had read so many medical journals. I had plowed through the internet, and I had put everything in place that needed to be put in place. All my tests annually, biannually, everything was done. Because I had been in a horrible situation of being in the back of ambulances one after the other. And so I had to survive. But this is wonderful. I'm listening to, this, and this is what we want. It's a wonderful quote is, without vision, people perish. And there needs to be vision, a longer term vision for survivors. And then they don't perish, they thrive, and they're looked after and they're cared for.
Do you know, Natasha, thank you so much for how you have been so eloquent about saying about the importance of it, because going back to Maria's point about not wanting to communicate about late effects sometimes, or that fear, you know, I think for all healthcare professionals, I could say myself that there were certain areas that I did find, you know, if you're having to talk to somebody who thinks they've just been cured of cancer, well, has just been cured of cancer, about potential late effects, about second cancers, it's a really scary and horrible thing to do, and to find the right words is really, really difficult. And I can say, hand on heart, I have not always got it right. And unfortunately, it is with practice that you improve. And ideally, you would do it in your communication classes, or whatever you want to do, listening to webinars like this. But it's about doing it and doing it again, where you start to find the right way of communicating. And I would still say that if I were doing it in future, I may well get it wrong.
Yeah, I can only agree on this. And I think, because this is what I actually experienced, was when I got my diagnosis, it was like the introduction of, okay, this is going to be now 2 years of your life that is going to be a bit hard. And after that, you can go back like to your normal life, to your old life. And I think we all know that this is actually not true. So even beside the side effects that might occur, there is no old life that you can go back to. It's just your new life that you kind of need to find into. And I think this would be actually the first step, to just not mention something like this. I think, as I already said also in the presentation, talking about late effects and things that might occur is frightening, not only for you as healthcare professionals, but also for us, because this is something where we don't know how our body will develop. So yes, this is frightening, and yes, the conversation about this will be frightening, but it's much, much more frightening to not know what is coming up and to experience all of this. To stand there alone, because if you address it with us together, and if we go through this conversation together, we at least have somebody that we know we can trust, and that we really know that we can get in contact with and ask about the things that happen. If nobody talks to us about this, there is also no person that we know that we can trust and that we can come back to. So yeah, it's frightening for all of us, but I think if we can go through this together, this will help you elevate your conversation skills on this, and us finding our way into and through this new life.
Yeah, I think, Hanne, you mentioned a really important word, I think, trust, because I think that's also something that's important for us as healthcare professionals. I think for us it's also important, or it's also nice when you see some of the survivors for many years. So you have kind of also, as you said, a trust or a connection, and then it's also kind of easier to talk about the topic of late effects, or maybe also late effects topics that maybe also survivors don't start asking themselves at the beginning. The whole topic that you mentioned at the beginning about body image or fertility or these things, relationships or partnerships. So these are also things, then it's way easier to communicate and to talk together, and to maybe also start asking.
Yeah, thank you so much, Maria, for bringing that up, because that was actually going to be a bit of my next question of what can we all do to establish a safe space or an open room where it's not, you know, a one-way street and a list of, so you had this, so now you can get this, but rather an open conversation where also people, I'm now thinking especially of maybe, you know, younger people, how they can feel safe enough to say, actually, I have a question. So I'll be really curious to hear from any of you what can be done within this conversation between a healthcare professional and a survivor, that the survivor feels safe enough and that there's space. I mean, I heard Emma, you said earlier about, oh no, it was actually you, Hanne, saying about going step by step, asking, do you want to know more about this? And Emma, you shared that, you know, it's not all at once dumped on the person, but rather, you know, you see them more often, so you have more chances. But what else can we do to make this a two-way street and a space where survivors feel empowered to ask questions and to bring up concerns. This is a question to all of you, so whoever has thoughts, you can just go ahead.
I was going to just start by saying that it's so important to structure these conversations, because often you only have one short appointment. It's a very short appointment, and there's a lot that could potentially be said. So one of the things we do is have a questionnaire for young people and their families to fill in before they come into the room, so that we can sort of try and work out what's important to them. I must say that often young people would just go, nothing, all the way down. But what it does do is it gets that young person on the right, in the right frame of mind, so they actually do start to think of some of the things that might potentially be of interest to them. It just starts to focus the conversation. And at some point we should get onto treatment summaries and long-term follow-up care plans, and whether they're a good or a bad thing, because I think there's lots that could be said around that.
Thanks for sharing, though. I think a questionnaire is a great start to just make the person reflect, and even before the appointment. But Hanne, I think you also wanted to share something, or not?
Yeah, I think what is also most important is to understand that these kind of conversations are a process. So this is not only one time point to address this and that's it. So this is a process that depends, of course, on the readiness of the survivor, because we already heard that there are a lot that are in this moment where you want to address it are not ready for it. But they will come back and they will be ready at some point. And also this process means that you need to repeat things, because I've also heard of lots of other survivors that they heard from their parents that this has actually been addressed also in their presence. But then in this moment, they were not ready to totally understand and really get what was talked about in this conversation. So this needs to be addressed again and again. And this is actually a process, I think, that needs to be, that is also a lifelong process, because there will be things coming up that, of course, also you cannot foresee, and that you cannot know already like 10 years before. So this is a process for the whole long-term follow-up care, and this is totally fine and totally okay. And yeah, it's part of the follow-up care that all of us need to go through or live with.
Hanne,
go ahead. I see your
Yeah, no, because we done a study. No, it's we did do a study over quite a few years where we video recorded follow-up care consultations to see how information about late effects are actually given, and then we interviewed people afterwards about it. And like you said, it should be a process. But we also discovered is a lot of young people don't know why they come to follow-up. So even starting the first, as the conversation, do you know why you're here? For us, most people didn't know. Oh, you're doing some blood tests. So if we do set the expectations of after however many years, you don't come to follow up to check for recurrence, we're checking to coming back to see, for potential late effects or effects that the treatment might have on you. Setting the stage, setting the expectations is a good start. And then I think a lot of adolescents, they are sick or being sick, so they don't necessarily tell their healthcare providers either how it is, because they don't want to talk more about it, or that they never had a body their age that's healthy, so they don't know what they should feel or how their body should be. So they really need a lot of support from the healthcare professional to raise topics that might be important. So they might feel a lot of fatigue, but never thought about being from the cancer treatment, just think, oh, maybe I'm just a bit more lazy than everyone else. So I think healthcare professionals have a very important job in terms of raising potential issues that could be relevant for the survivor, and open up to talk about late effects that are serious, but also not medically serious, but very bothersome to live with like fatigue, I think really helps. And also, I wrote a list, but creating some time alone with survivors. So we had very good effects of that from they're about 12 or 13, if they want to. But then not ask them, oh, do you want to talk with me about mum and dad? Then they will say, no, they don't want to send the parents out because they're loyal to the parents. But if the healthcare providers say, oh, we have a new routine now, we would like to speak with you alone for a bit, would that be okay? Yeah, 100% we want to do that. So, and that opens up for a whole lot of new conversations and concerns that will not come when the parents are present. Not for the whole consultation, just a small part of it.
Yeah, that is really interesting. Thank you, Hanne, for sharing that. I think, again, very, very practical advice here from research. I have one more question for Natasha and Hanne. And I'm so astonished with your stories and how you kind of had to take a lot of charge yourself, and take charge of your health, bring up things, bring them up again and again. And now we've, of course, said that how great would it be if your healthcare professionals would share the things again and again, but in your stories, that wasn't the case. So I was just wondering, again, especially thinking of young people affected by cancer, what your lessons were in that way, or what lessons you learned along the way about taking charge of your health, and if there's something you would like to share with the audience.
You want to go? Shall I go? I once had this thought that came through my head. I was stood in my kitchen and this thought came in my head. It said, so imagine when you go to the fairground and you have the people that shoot the little ducks. We've probably all done it. And this thought just came in my head. Where are you? And I thought, well, I'm the one with the gun. And I know the context of things we see on the news, but I'm actually talking in an image way. I think you can either feel like a sitting duck, or you can actually, have some agency, find the information, and then you're armed and you're ready. And you won't let things steal your life. For the good part of my story, so I've got lots of good parts to my story, but one of the excellent parts of my story was I was able to have children, and I had 4. So yeah, 4. And I think that there's a fighting part of you, which is, I will not allow disease to steal and destroy. So I'm taking up my gun. I'm finding the information that I need to find, and anything that comes to try and steal from me, it's going down. And I think this is just a wonderful way. Like I said, you have to have vision as well for your life. Think of the beauty of the life that you've been given, and think of this wonderful vision that's in front of you of all the life, all the love, the relationships, all that you can achieve with all the unique giftings that you have, and don't let anything come and steal that. So if that means you have to go and you have to do tests, nobody likes doing it. If it means that, you do it, because you've got a vision for your life. And so the short-term pain of going for tests, going in and being checked, it's never fun. But if you do it and you keep your vision, then your life will be amazing.
Well, I think I can only agree. Thank you so much for sharing that. And what I heard, practically speaking, was find knowledge and act, be proactive, especially if you are in a system where you're not being asked all the questions and you're not given all the information. Then being proactive, unfortunately, is very, very important. Hanne, is there anything you would like to add from your perspective to that?
I was now thinking, and I was like, what did I learn through this? And I think it's a lot. I'm not even sure if I can put all of this now into a few sentences, but I think what was most important for me was because So the thing is, when you are treated for, especially for such a disease in the age of a child, and I was 14 when I got my diagnosis, and I don't know how it is in other countries, but here it is, you are, no matter what, but you are more or less treated as a child, and every decision and everything is kind of taken away from you, and everything that needs to be decided is more or less decided by the doctors and also by the parents. And then you turn 18 and suddenly you need to do all of it yourself. And I think this is the most important thing that I learned through this. So through learning that there are late effects, and through learning that, especially in the beginning of this, there is nobody that, again, takes it over for you and does it for you, as it has been the case until I was 18. So I think it was, or it is still, because I'm still learning and I am past 30 now, that I need to take care of myself, and that it is okay to go somewhere and say, hey, I need this now, because this is for my health. And yeah, so nobody is going to do these things like voluntarily, and super happy for you. Is you that needs to ask for things, and that's okay. I'm allowed to do this.
Tessa, can I just say one thing that keeps cropping up in my head is that we are talking about the potential risk of late effects for most people. So actually there's many people that will be at risk of having a late effect but not experiencing that. And that is that balance of how we communicate that risk, knowing that actually a lot of people will not experience those risks. And it's hard, I think, to do that, to communicate that. But a line that Hanne always it repeats to me so often: knowledge is power. So when I, as a healthcare professional, think, well, do they really need to know all of this? Because, you know, that paternalistic healthcare provider in me, you know, can I it is about sort of how you communicate that risk while still allowing people to have hope and to acknowledge that actually they may not have that, but also if they, because of the way that they live their life or they go for screening and things, they are either reducing that risk or acting on it in a timely way that hopefully helps them to be healthy and live well.
And give yourself some treats. I mean, to be honest, when I go for horrible tests, I'm already looking on the internet at what I'm going to treat myself with. You know, give yourself some treats. Have some fun with it. When I went to go for colonoscopy, I even asked my husband to write in, this is going on the internet, oh well. I even asked my husband to write on my bottom cheeks, no polyps, with a big smiley on it, because the risk of cancer was just going up and up every year when I had my colonoscopies, and they kept having these awful faces. And I thought, no, I'm not. And so I said to him, write it on my buttocks. And the whole way down the corridor, I was chuckling away to myself as I went into the room, and I said, well, you will have a surprise when you see my buttocks. I'm not intending on having cancer again. I've had enough cancer, thank you. So have some
We
fun.
need some practical tips like that, Natasha, for everyone, I think.
I may regret having said that.
Well, that's communication, isn't it?
Exactly. Well, you won't forget that one, will you?
But can I just add to what's being said about knowledge being power? Because there's focus groups we did with the survivors who had lived a long time without information about late effects, had lymphomas, Hodgkin and non-Hodgkin lymphoma, had a range of late effects like yourself, Natasha. And they said, some of them said, you know, coming to the hospital and getting information about late effects, being able to understand why I am the way I am, was like all Christmas Eves in my life coming together in one day. It was the biggest day of my life. All the puzzle pieces fell into place. I got lots of, in Norwegian we say, hooks to hang things on. It just really helped them understand why they feel the way they are, what their bodies are the way they are. And these are things for healthcare professionals are very sort of course it is the way it is, but for the people with the lived experience, they don't have that medical knowledge. So there's a lot of things that you think might be a bit odd, but you don't know. So we had people in there who had radiation to their neck, and they had very underdeveloped muscles. So someone couldn't keep the head up for the whole day, but nobody told them that was because of the radiation therapy. So they were just wondering, you know, why am I like this? So I think it's just such a powerful knowledge to take on. And like you said, Emma, not everybody gets late effects, but if you do get them, you can recognize them and you feel empowered to do self-advocate and go to the healthcare professional and say, look, having these problems, I think it might be because of the cancer treatment I had 30 years ago. Because if you can't say that and you go to your normal GP, most of them will not know what you're talking about. I think it's knowledge is super important.
Yeah,
to be
thank
honest,
you so much.
going with medical documents as well. I know before I missed a very massive heart attack, and I actually walked in. I'd been to 4 different cardiologists saying there's a problem here, and no one was listening to me. And then I just printed off radiation associated cardiac disease document from the Cleveland Clinic, took it with me, put it on the desk of a cardiologist and said, I have to have a stress test. There's a problem. And lo and behold, I was right on my way for a major heart attack. You know, I do think it is really important. It is important to have this empowering here. It is important as well to make yourself heard. And I'm very thankful for these new groups that are setting up who are actually giving a voice, because there is, and unfortunately, there is a lot of medical gaslighting as well through lack of knowledge. I was told many times my rapid heart was just because I was a little bit neurotic, or, you know, or I was a triathlete even after Hodgkin's. And I was told that basically my heart was very rapid because I was unfit. Well, that didn't really go together. So, you know, platforms like this are wonderful for giving knowledge to people. So gain as much knowledge here as you can.
Yes, thank you so much for sharing that. I would like to end, because we are getting close to the end of this webinar, with a speed round. It has to be a speed round because we spend so much time on the other topics, and that is what should be implemented? What should people do with the knowledge today? What is your take-home message that you would like to give to the people? And I know it's difficult, but you get 1 sentence and 1 sentence only, so whoever is ready first can shoot.
I'll go. Late effects is a partnership between the healthcare professional and the...
Thank you.
Just do it.
Just do it. Oh, I like that one. You know, you don't have to get it perfectly as both sides. Just do it. Nice.
Exactly.
Who's next?
2 sentences. You might be uncomfortable providing information about late effects, but as a doctor, you do a lot of other things that are uncomfortable to patients. So just, like Hanne said, do it.
Thank you. Maria, Natasha?
My sentence. I think there's just 2 words. It's even not a sentence: knowledge and empowerment.
Thank you. And Natasha?
I'm going to have to go back to vision. Have a vision for your life and live your life.
Great. That is a fantastic take-home message. So I hope that this conversation was interesting, insightful, hopefully impactful for all of you. I could have continued listening for hours. I am actually shocked at how short this webinar is in the end. But unfortunately, yeah, we do have to wrap it up. So I will share my screen again, and it has a link to the Menti again. Jaap also put the link already in the chat, so please go there again. And there should be the question of what your take-home message as the audience is, because I hope that your questions were answered and that you learned something. So actually I have to stop sharing to go to the Menti. I think otherwise the question won't pop up, but I hope it works and you can see the question now and you can add your take-home messages. Otherwise, just put it in the chat. That's also fine. Oh, just do it. Yeah, that one's stuck. Lots of just doing it. Networking, yes. I think that's also one not to underestimate, to just keep on talking and reflecting together. Together, not alone. Yeah. I think that's also a really important one, that yeah, you can only improve communication together and learn from each other. Knowledge is our power. Sharing this info, yes, that is great. Dare to ask. Wow, yes, that is, I think, is also a good one. It's truly long term, yeah. Helena, is there anything in the chat?
Just compliments and people wanting the recording of the webinar,
Yes.
but that will be available later.
Yes, yes.
And it
we may
also
need-
says now, talk, do everything you can.
And repeat information is in the chat, and I think that's a big one.
Mm-hmm.
Just because you've
Yeah.
said it once doesn't mean that it's either been heard or said in a way that somebody could even understand.
Yeah. It's
That
really nice to see the take-home messages.
One thing we haven't talked about is what words you use, and use a simple language that people can understand. I just spoke with an 18-year-old who's been to his last follow-up, and he goes, they kept talking about this fertility thing. I have no idea what fertility is. So make sure the information is understood.
Yes, that's, I think, also a very, very, very important point, to make sure that it's, again, not a one-way street but checking in with the person you're talking to. Some very, very, very last remarks. Well, it was brought up again, the recording. It will be available on YouTube and on the PanCare website. So if you want to share it, if you want to use it for educational purposes, it will be there. And as I said in the beginning, there is a feedback form for this webinar. So you can either scan the QR code or go to pancare.eu/feedback. It's very short. It's 4 questions. So I think if you have the time, please let us know what we can do better, or what you would like to see again, if you like the panel format, or if you prefer just presentations after presentations. Just let us know what you think. And again, also there's room to let us know which topics you would like next, because we have a lot more webinars to come, and we have, of course, our ideas, but again, we're very open to your suggestions. And actually, the next webinar in the series is already scheduled for the 30th of March. It's about implementing recommendations for mental health care and psychosocial care. I cannot yet tell you much more than that, because of course we're still planning it, but you can already register. So if this is something that is interesting to you or relevant to you, you can either register through the QR code, or well, I hope I saw that Jaap was just kicked out of the meet. There's also a link. Maybe someone else can put it in the chat. Yeah, so this, I think, was my very last slide. Yes, so I will leave on the QR code just in case you want to register. I would really like to thank all the panelists and Hanne for presenting. I hope that this webinar was interesting and answered the questions that you came here for. I think we could have continued 4 hours. But again, I'm very grateful for our wonderful panel, and for Helena for co-hosting this webinar with me, and of course for Jaap and Jeroen for their support, and for all of you for being here and interacting with us and taking the time to learn more about talking about late effects